right. Good afternoon, everyone. Thanks for joining us this afternoon. We are really excited to have you here with us as we reveal the 2019 Illinois Risk and Reach report. Well, technically we're in 2021, but the data that we're going to be looking at, as you can see, is a pre-pandemic view. So it is from the year 2019. That is the earliest or the most recent data that we have available. I want to, what we're going to kind of do for this particular webinar is walk you through the report findings. And as you are familiar with the report, you're going to see a whole bunch of heat maps, and we will also have a fiscal scan at the end of the session, and then we'll have some time for Q&A. But we're going to kind of highlight some key messages. And if you have questions, though, throughout, please don't hesitate to put them into the chat box, and I will try to kind of integrate responses throughout the presentation. And so I didn't introduce myself. I'm Christina Passioni-Sayas. I serve as the Senior Policy Advisor for Erikson Institute's Policy and Leadership Department. I'd love to get us to the next slide because we're going to launch a poll and want to kind of see who is in the Zoom with us. We all have kind of, different hats that we wear, and wanted to get a sense of who's with us today. And if you should have a poll launched on your screen, and you can select one of these particular identities or roles so that we can see who's all here with us. Give you a couple minutes to do that. Right. Do we have, Luke, just want to make sure, are we good with enough responses here?
Yeah, it looks like we got a lot of advocates, a couple providers, funders, researchers. Looks like we have about at least one person representing almost every category in this poll.
Great. Sounds like we've got a good mix, but advocates are coming through big time. This is a great time because this is going to be some very informative data in terms of some of the campaigns that you'll be launching in the years to come. So next slide, before we get started, I'd like to acknowledge the partners who lent their expertise to produce this report. You'll see here the logos for the three data partners here. So we've got the Illinois Early Childhood Asset Map at the University of Illinois, known as ICAM, and also the Fiscal Policy Center from Voices for Illinois Children. I'm also delighted that some of our colleagues who comprise the core partners are going to be joining us for this webinar, and also some of the Q&A session. So from ICAM, we have Keith Hollenkamp, he's the Assistant Director, and from Voices, we have Mitch Lipson, who's the Director of Governmental Affairs. I also want to acknowledge our funders who have really put together resources to make this project possible, and it's the Irving Harris Foundation, the Pritzker's Children Initiative, and through one of our elements of the Preschool Development Grant, the Virtue 5, through the Governor's Office of Early Childhood Development. I also want to acknowledge our illustrious advisory council of 40+ stakeholders representing the private and public sectors across the state. They provided feedback throughout this process so that we can ensure that the report would be relevant, it would be timely, and it would be accessible to ultimately reach our overarching goal of the information being actionable. So let's go to the next slide. So what do we mean by risk and reach? And this is just a level set because I can't assume that everybody is familiar with the report, but just want to make sure that everyone kind of understands it. And so the report's a curated data set that provides a comprehensive snapshot of child well-being. In a few minutes, I'm going to go through the summary of the indicators and how we chose them. But we produce this report every 2 years, and this is the second iteration featuring, like I said earlier, a pre-pandemic snapshot from 2019, unless it is otherwise noted. All data is from 2019. And just, again, to level set, because there's typically a lag in the availability of state level data, this is the most recent data set available. And there's also greater confidence in its quality because, as we know, 2019 was a beast. 2020 was a beast. There's some concerns right now in terms of the quality of the data that's available. That'll be something interesting that we'll have to take up in our next round when we do the next iteration of risk and reach. But let's go to the next slide because when we're talking about data informing action, we wanted to kind of give you a sense of how risk and reach informs action. And, it can certainly, the data in here inform policy at the state level and program funding decisions made by local and state governmental, non-governmental stakeholders. And it can also, aid them in facilitating greater equity for Illinois' young children and their families. Ultimately, it's designed to evaluate how well are we reaching children experiencing risk factors in their specific geographies. How can we support communities to better understand the allocation of resources in early childhood programming gaps and needs? And ultimately, how can we inform decisions regarding policy practice and funding affecting early childhood with these data? So that's ultimately what we're trying to do here. Let's go to the next slide. So because this report is focused on young children and we're defining that as children age 5 and under, let's provide some context by examining the 2019 total state population disaggregated by race ethnicity. You'll see here we have 12.6 million individuals living in Illinois, and you will see the demographic breakdown. You'll notice if from the last time we were able to get a little bit more nuance. Before, we only had 4 categories in terms of our race and ethnicity, where we smushed various categories into the other segment, which is the color green, but we were able now to break out Asian, non-Hispanic. So now we have a little bit more precise kind of reading of what our total Illinois population is. Let's go to the next slide. So let's zoom in now on children age 5 and under by race and ethnicity, same year, 2019. And I'm sure you noticed that the race ethnicity breakdown reveals greater diversity in our young child population. And this is the ACS 5-year estimates. And it's also the total number is 916,880. Which is a little bit of a difference, slight decrease in the number of children compared to 2016. And actually, if we go to the next slide, I can talk a little bit more about that. So this slide just, we obviously know what the number in aggregate is, but now we want to kind of show you where the concentration is of children 0 to 5 by county. And so that's what this map seeks to show you. The darker the blue, the higher the number of children age 5 and under living in those particular counties. You'll notice too that of those 916,000 children, they make up 7.24% of that 12.6 million of the residents in Illinois. And Illinois has seen a 3% decrease in the total child population under age 5 compared to 2016. It'll also be interesting to kind of note when the census data does come out to see if there's any kind of distinction and difference. But we know that historically there has been an undercount of children in the census under age 5. And, there's also something to kind of consider in terms of the decrease in the child population. There has been a downward trend in the state's birth rate as well. So that could all be contributing to this decrease. All right, let's go to the next slide here. Like I said, if you all have any questions, please don't hesitate to put them into the chat and I will address them as we move along. Okay, so what you'll see here, starting with the risk. So the report is designed to show you risk, and what I want to kind of clarify is not individual risk, but the risk that's situated in the environment and systems and structures. And I stress this because during the production of the report, the advisory council the first time really made a conscious decision to reject the traditional uses of the word risk, like at-risk children, at-risk communities, and reframe this definition of risk to be situated in the environment and structures. When we reject risk as an inherent trait in individuals, it directs us to locate risk in systems and structures and develop solutions that really get at those root causes. And we know that, no child is inherently a risk, but we do know that children and families experience risk factors or structural barriers that undermine their development or ability to live up to their greatest and fullest potential. So this report will visualize the concentration of risk factors experienced by children and families by county and organized in these three domains that you see here. So family stability, which is the purple section of the report, health, which is the green, and early care and education, which is the magenta section of the report. So let's go to the next slide so you can see the 15 risk factors. So risk factors are completely the same as the last iteration of the report. There's 15 of them. They were selected by the advisory council based on two criterion. First, that, the risk factor needs to, child development research needs to validate that indicator as producing conditions and circumstances that may compromise optimal child development. And we also needed to have the data available to us at the county level. Something to note, it's kind of interesting, is that other states that have produced these reports and that we learned from, they selected in total about 12 to 15 risk and reach indicators combined, while we selected a total of 34. And so, we obviously have a much more comprehensive and fuller view of how we're looking at child well-being. So let's go to the next slide so we can dive into these risk maps. So again, as you all know, these are the factors that undermine optimal child development without any kind of mitigation. And let's go to the next slide, because we have a little bit of a caveat here that we want to highlight. And I'm actually going to turn this over to my colleague Keith over at ICAM, because he can kind of explain it a little bit better.
Hey everybody, yes, so when comparing the 2016 and to the 2019 report, it's important to really go back to how we calculate these risk levels. All of the risk levels are calculated based off of the indicators and the landscape of that particular year and then compared to one another. So all of the 2016 data is based off of population and numbers in 2016, and all of the 2019 data is based off of 2019 population and data around that year. So when comparing the two, it's not always accurate to say, look at Champaign County where I'm at and say, oh, we went from low risk to a high moderate risk in maternal education. What's really more accurate is to look at the individual county rate that is printed next to each table and in each map to kind of look at change there, because other factors between the years have changed. Population has changed, as we just went over, and different numbers change, and then the comparisons against each of the counties also change. So the landscape and the benchmarks are different between 2016 and 2019, so it's not always accurate to compare the two. What I like to say is, for example, against Champaign, if Champaign changed from low moderate to high moderate, you can say in 2016, given those conditions and those benchmarks, we were low moderate risk. But in 2019, given the new conditions, we are now high moderate risk. So there has to be that little caveat there of it's all based off of the data from that specific year. I hope that helps. I will gladly answer any more questions about that to anybody who has.
Thank you, Keith. pretty nuanced, huh?
Yeah.
This is where data gets complex. Okay, so let's go into these maps here. And, you know, the first one, maternal education. I'm going to orient you to the maps. So first and foremost, you know, just to kind of give you a sense before I even talk about like what this map is showing. So blue map illustrates the level of risk calculated for a county. There's 4 levels, as we've mentioned: low, low, moderate, high. To the left of the map are the ranges established for the risk levels, which vary for each risk factor. And so that's where you see the little colors in the blue, and then there's some numbers there. To the right, you have the average of county rates, and those are determined by adding all available county rates and then dividing by the total count of those counties. That's a new feature that we've added this time. You also have right underneath that average of county rates, the state rate. And that's obtained by dividing the number of cases by the total relevant population. So for example, in this case with maternal education, it takes all of the instances of births to mothers without a diploma and divides that by the total number of children age 0 to 5 in Illinois. So it's a slightly different number in terms of comparing that to the average of county rates. You know, we were data geeking out over here. And then the national rate is provided for additional context to see kind of how Illinois stacks up nationally. And then when available, in that white box you'll see there, we've included the disaggregated race and ethnicity data at the state level. Okay, so now that I've kind of explained the map here, this particular map is on maternal education, and this is the number and percent of births to moms age 20 and older without a high school diploma as of 2018. So this is where we have a little bit of a diversion. This was the most recent data that we had. And maternal education, we know, can influence child outcomes because essentially it doesn't mean that, you know, mom, because she doesn't have a high school diploma, is not equipped and doesn't, you know, want to do what's best for her child. It just means that she may have limited access to stable employment, to a livable wage, to high quality early care and education and health services. So it's really about some of the structural barriers that she may encounter that, again, will spill over to what access and opportunity her child has. And so the state rate for this is 8.23% this time around compared to 9.1% in 2016. So there is a slight decrease from the 2016. Now, something to kind of pay attention to on the race and ethnicity tip. What you'll notice is that, you know, those little kind of pyramids don't add up to a 100%, right? What we're looking at is actually the experience of so we'll point out the blue one because that's the highest one, and those are representative of Latinx moms. So in the universe of Latinx moms, there are 20.47% that are age 20 and above who are not high school graduates. So it's the experience of this particular risk factor within the subsets that we're looking at by race and ethnicity. And so what it helps us kind of understand is peel back the onion, right? When we're looking at maternal education, let's be specific, let's be deliberate in terms of what are the specific barriers that Latinx moms may encounter in meeting their educational goals. There could be, you know, additional family responsibilities. There could be challenges around language and not having access to language resources to be able to pursue. There's a variety, but it helps you kind of narrow in your focus in terms of how you may mitigate this particular risk factor. So let's, what I'm going to do now is we're going to go through the other 14 risk factors so that you can kind of see, and, you know, per usual, like what we've said in the past, what's super interesting about these data is that each risk factor kind of has a little bit of a different flavor to it. You're going to see, pay attention to the colors and how they move around across the state. And what they tend to highlight is that, you know, risk exists everywhere. It kind of disrupts some of the, you know, assumptions that we have about particular geographies. And so it'll be really interesting as we cycle through. And like I said, you know, please don't hesitate to put any kind of questions in the chat as we cycle on through. So let's go to the next one. So parental employment here. So this is the number and percent of children age 5 and under with no parent in the labor force in 2019. We know that families with no working parent are more likely to live in poverty, which leads to limited resources and stressful conditions that undermine optimal development in young children. And so the state rate is 6.59% in 2019 compared to 7.4% in 2016. It'll be really interesting to kind of also see what this looks like post-pandemic. Because I'm sure, you know, based on what we were all working towards helping to support across the state, you know, we know a lot of people have lost their jobs. So let's move to the next slide, poverty. So this right here is the number and percent of children age 5 and under living below the 100% federal poverty level in 2019. And we know that children living in poverty may have greater exposure to risk factors that can affect brain and social emotional development. We know that, you know, risk factors tend to travel in packs. And when you are living in poverty, you may not have stable housing conditions. You may not have access to, you know, high quality healthcare and your baby wellness visits. You might have increased exposure to environmental toxins. And the state rate in 2019 was 18.79% compared to 21.5% in 2016. And I'd be remiss if I did not mention, because today is the big day that everybody is talking about, the federal child tax credits and cutting child poverty in half by, you know, families. You know, obviously, if you file taxes, or even if you are a non-filer, but you are eligible, you can get a monthly child tax credit that goes towards your children under age 17 or 18, I'm sorry. And this is, you know, this was a part of our pandemic relief at the federal level. And I know that the current administration is seeking to make this permanent. Okay, it looks like, thank you very much, Keith, for handling that. Let's go to the next slide here. So child care cost. This one here is average child care cost and average cost as a share of median family income in 2019. So the federal government recommends a child care affordability threshold of no more than 7% of a family's income. And actually, recent actions taken by our governor is putting us on an aggressive path towards that goal. Because in Illinois right now, what you see is we've started to trend in that direction as a result of some of the policy changes we have made. So state rate is currently, or in 2019, 9.72%, and then compared to 10.6% in 2016. So let's go to the, and again, you know, super interesting actually, if you look at the breakdown by race, ethnicity, look at how different the experience is based on race and ethnicity. So let's go to the next slide, housing costs. This one here represents the percent of occupied housing units, number and percent of occupied housing units that cost more than 30% of household income in 2019. So spending more than 30% of income on housing leaves families with fewer resources for necessities, including high quality childcare. And the state rate is 30.30% compared to 32.8% in 2016. And I'm sure too, this will be another data point post-pandemic that'll look interesting, and also something to consider too, because another plug I got to put out for the state is, there's a rental emergency assistance program that is about to close for tenants who need emergency assistance on Saturday. So really important that we get the word out, because families can get up to $25,000 in emergency rental assistance if you are not able to pay your rent. So that'll be enough for my PSA on state resources through the federal investments. Okay, let's move on to the next slide. Homelessness. So this is the number and percent of kindergarten students reported as homeless in 2019. We know that housing instability can interrupt student learning and present barriers to academic achievement. But what I think is super important to kind of note in this is a reporting data point. So these are kindergartners who were reported to their school's education liaison per the McKinney-Vento Homeless Assistance Act. So this isn't necessarily a full and accurate picture of all kindergartners that may be experiencing homelessness or housing instability. This is only a representation of those who have been reported to the liaison. Something kind of interesting to note, clusters, right? Compared to the rest of Illinois, you'll kind of notice those southern counties see a higher level of reporting, and it kind of draws you or kind of pushes you to ask some questions, like, is it that they're doing a better job of reporting, or is it that we have higher concentrations of kindergartners that are experiencing homelessness? And something super important to note is that all of these data are at a county level, and, county level data is blunt. It does not give you a very nuanced understanding of how different communities within a county may be experiencing a particular risk factor. And it's really important to note that, there are those distinctions and differences. But even more so, why it's important for us to have the discussions at a local level to better understand the nuances in the context, or to better contextualize these data. Okay, thank you, Veronica, for putting that up. The link is in the chat in case you want to learn more or push it out with the rental assistance. Let's go to the next slide. Maltreatment. And you'll notice that all of these first set of indicators are all under our family stability domain. So maltreatment, these data are the number of indicated victims of abuse and neglect, and rate per 1,000 children age 5 and under in 2019. Child maltreatment is defined as physical, emotional, sexual abuse and neglect by a caregiver. We also know research has confirmed that it can cause long-term cognitive delays, affect academic performance, health outcomes. And you'll notice that the state rate is at 19 per 1,000 children compared to actually 14 per 1,000 children in 2016. Something also important to note here is, again, this is a reporting data point. So it's hard to kind of discern, is there an increase, or is there an increase in indicated reports, or is it just that we are reporting more and therefore we're capturing more indicated reports? So let's move on to the next slide, drug overdose deaths. So we were trying to kind of respond when we first came up with this to some of the advisory council members felt it was important to kind of get a snapshot on how the opioid crisis is affecting young children. And so we couldn't find that. It was pretty difficult to get that type of data. But what we did is, this is a more of a universe data point. So this is the number of drug overdose deaths and rate per 100,000 population. So obviously this is not children 0 to 5. This isn't even reduced to the universe of parents with children 0 to 5. This is more of an overall. And so, you know, and this is obviously, as I mentioned, due to data limitations on substance use disorder. Adult drug overdose deaths are like a broad kind of proxy. That's how we're using it for children's exposure to parental substance use disorder. And what you'll notice here is that the state rate is 22 per 100,000 compared to 19 per 100,000. And that's an increase from 2016. Something super interesting to kind of note, look at the, the race ethnicity breakdown. And I think, some of this may have to do with, the longstanding concerns that we've had with respect to structural racism and its application in the healthcare and substance use disorder system. Because what you'll note here is Black Americans are obviously experiencing this at a higher rate, but they're often left out of the discussion and have not seen or had broad access to the advantages from the advances and changes to treatment for opioid and substance use disorders. So just wanted to kind of highlight that. But again, when we disaggregate data in this way, it kind of helps us. It helps us to better pinpoint some of these structural issues and obviously come up with solutions to mitigate them. Let's go to the next slide because it kind of builds a little bit on why we need to look at data disaggregated. So that, this right here, maternal morbidity, now we're in the health domain. It's a perfect case study on the importance of disaggregating data by race ethnicity for two reasons here. One is you're going to notice that the majority of the state is shaded white, indicating no data is available. If there's less than 10 cases, the state suppresses it. And so the question becomes, though, is, because severe maternal morbidity is a rare outcome and data were only, available at the county level in 22 of the 102 counties, which is 4 more counties since the last report, it begs the question, if it's such a rare outcome, why, when we disaggregate by race ethnicity, the data reveals that Black moms are experiencing severe maternal morbidity at 134 per 10,000 deliveries. And that is basically, it's a little bit under twice the state rate here. So it basically provides us with an opportunity to have some pointed discussions on, defining severe maternal morbidity, data collection standards, and, the role of structural barriers and institutional racism in contributing to these outcomes. Something also to kind of note too, since the last report, there's been a definition update at the federal level for severe maternal morbidity. Just to level set for everyone, severe maternal morbidity includes unexpected outcomes of labor and delivery that result in significant consequences to a woman's health up to 12 months postpartum. It does not include postpartum depression. And, excuse me, to align with the updated definition, blood transfusion is not included, and length of delivery hospital stay no longer determines instances of severe maternal morbidity. Sorry, got something in my throat. Anyway, but just wanted to kind of point this out because this is a really great example of why we need to see data disaggregated by race, ethnicity, and address it. And the General Assembly recently has taken this up in several legislative measures with task forces and with trainings and other protections for moms, particularly Black moms, so that we don't continue to see this trend. Let's go to the next slide. Preterm births. So preterm births, infants born before 37 weeks gestation. A premature infant is one who is born before 37 weeks, and they often require longer hospital stays, but they may also experience long-term cognitive and physical impact, including asthma, vision, hearing loss, cognitive disabilities, behavior challenges. And there's several factors that can elevate the risk of preterm births, including smoking, alcohol, illicit drug use, domestic violence, very high stress levels, maternal depression, and prolonged work hours involving standing. And so for many of these risk factors, we know that adequate prenatal care is a super important intervention, and you'll see what that looks like when we go through the REACH slides. All right, let's go to the next one. Lead exposure. So this is the percent of Illinois children aged 6 and under who were tested for blood lead and found to have elevated blood lead levels. So those tested, and among those tested, those that have an elevation. So unborn babies, young children, they're more susceptible to absorbing and retaining lead. And we know that prenatal lead exposure can affect brain development. It can lead to premature birth, low birth rate. Childhood lead exposure can lead to headaches, stomach pain, challenging behavior, anemia, problems with, optimal brain development. Lead paint is the most common way children get lead poisoning. Some toys, other products manufactured outside of the country have been found to contain lead too, but it also can be, in our soil, in our water that flows through old lead pipes and faucets. And I'm so glad we passed legislation on removing lead pipes, along with, there's a pilot that's currently going on to automatically, for children who present with high blood levels, they're automatically able to access early intervention resources without having to demonstrate developmental delays. And so here's something else to kind of check out. That cluster there on you'll notice on the western counties, they see higher levels of risk. Again, kind of asks you to look a little bit deeper. Is it because they're testing more and therefore they're able to capture it? Is there something going on in the environment there that's leading more young children to have an elevated blood lead level? And so actually some colleagues at Erikson are studying that, along with, the impact of that specific pilot, where you get kind of pre-authorization to be in early intervention with this exposure. Okay, let's go to the next slide. This is going to conclude the health domain. Violence exposure. This is the rate for violent crimes per 100,000 population. We weren't able, obviously, and nobody, I don't think, collects data at the county level on children's exposure to violence. So this is one of those universal data indicators, and that's why the violent crime rate serves as a proxy. We know that violence, creates stress, and stress that's chronic can become toxic, and that goes, it can infiltrate the relationships between young children and their caregivers if everyone is experiencing stress. This is not just looking at violence through the lens of the individuals involved, the perpetrator, the victim, the survivor. It's really looking at it as an environmental factor and how that can really affect young children's development. And in this case, this is a data point where the race and ethnicity data was not available. So let's conclude the risk and REACH section. We've got 3 more indicators on the risk side in the early care and education. And this is kindergarten readiness. So the number and percent of kindergarten students without demonstrated readiness in school year 2019 to 2020. And, we know that children entering kindergarten exhibiting the agreed upon threshold and skills and abilities necessary for school are more likely to stay on track and experience long-term academic success. The state rate is 75.42% compared to 76.1% in 2017-2018. So we've made some headway on that over the past few years. So let's go to the next slide, 3rd grade proficiency in language arts. So this is the number and percent of 3rd grade students not meeting expectations in English language arts in the school year 2019-2020. The Illinois Assessment of Readiness excuse me, is the assessment that's used statewide for third through 8th grade. And, you know, the results provide an understanding how children are progressing, and they also connect to this, you know, birth to third continuum. So this is sort of after although the kindergarten individual development survey is not a high stakes, it's not even an assessment, it's more of an observation tool to really drive instruction and inform parents about how to support their child's development, whereas this is our first benchmark in third grade, when we really are able to see how young children have advanced and progressed and, you know, moving from learning to read and reading to learn. So let's go to the next one, and this concludes the risk indicators, and this is third grade proficiency in math, same assessment. And the state rate is 63.68% compared to 63.8% in 2016 and 2017. So we've had just a tiny improvement. And so as we conclude this section, we have another poll for you all, kind of just interested in seeing what you all think about this. So where does change need to happen the most? Is it at the local level? Is it the state level? Is it funding distribution? Is it other? If it's other, you know, if you select that, please do, you know, type in the chat what you think. And we'll let this go for a few more seconds. Also our way to make sure we're checking you guys didn't fall asleep on us. This is a lot of data. All right, how we looking, Luke?
Looking good. People answered every single one of these items, and so but statewide policy stood out as the #1 place where change needs to be made.
Indeed, we've got a lot of work to do, and you know, I think the Funding Commission gave us some great guidance and recommendations on that. Okay, so moving us along, next slide is the overall risk slide, and actually what this map is going to show you is the base of all of our REACH maps, okay? So overall risk assigns each county to an overall risk level based on their average score across the individual risk indicators. So how did we get there? We added all 15 indicators and divided it by the number of indicators present, because in some cases you did have some in some cases you had some counties that didn't have any data presented. And so basically that indicator was removed from the county's calculation of their overall risk score. So this kind of gives you that comprehensive snapshot, right? Because we do know that risk travels in packs. And so we see that there's quite a bit of dark blue around the state, but there's also some light blue. And so we'll have some in this next section in terms of REACH. We're going to start looking at, you know, the publicly funded programs and services that support early childhood well-being and where those resources are distributed. So let's go to the next slide so that you can see now the 19 indicators representing public programs and services. And they're selected, you know, organized by the same 3 domains. They needed to represent a policy lever that would specifically mitigate the selected risk factors. And you'll also notice that there are a couple new ones that we have added on. Under family stability, we added the Illinois Earned Income Tax Credit, and then the healthcare coverage under health. This was one that we kind of debated a little bit the last round, and because we were doing so well as a state, we said, we're good. But we've kind of backslid, so we wanted to look at that again. So let's go to the first of the REACH slides. So, you know, as I mentioned, the base is this overall risk, and then the yellow density dots show you the REACH. So the larger the dot, the greater the REACH of this particular investment. So this is the percent of income eligible children or families with children age 5 and under receiving TANF, the Temporary Assistance for Needy Families. It's cash assistance, employment services for pregnant women with their children. State rate is 24.96% compared to 24.6% in 2016. So there has been a slight increase. And again, this will be another really interesting one to look at once we have some post-pandemic data. Child care subsidy. So this is the percent of income eligible children age 5 and under receiving the child care assistance program benefits. And CCAP, as it's known by its acronym, can help families pay for care in eligible center or home-based early childhood programs. State rate is 23.54% compared to 19.36% in fiscal year 19. So it's good that we have an increase of income eligible families being able to access this resource. And if you may recall, the 2016 data, was right on the heels of when we had some significant limitations on eligibility as a result of some emergency rules that were instituted by the former administration that cut 90% of eligible families. So we're making some headway, and I know that the agency has done a lot of really good outreach work. So again, it'll be interesting to see what this coming out of the pandemic, and particularly what the Funding Commission is going to be embarking upon in terms of some regional hubs that'll be looking to do a lot of outreach and engagement with families. Let's go to the next slide. This one is the percent of households receiving HUD, housing assistance. This is at the federal level, and these are programs that can, provide relief to working families. Although we do know there's a long way to go in terms of, adequate funding to serve all who are eligible. The state rate is 18.58% compared to 18.3% in 2015. Now let's go to the next slide, food assistance. So percent of income eligible families with children age 5 and under receiving the supplemental nutrition assistance program, SNAP benefits. And SNAP boosts household budget and, food budget specifically in Illinois, and more than half of participants were families with children. And the state rate is 87.43% compared to 81.6% in 2016. So we've increased the coverage of eligible families over the past couple of years. Let's go to the next slide, permanency. So this is in relationship to the data indicator on maltreatment. So the number and percent of children age 5 and under attaining permanent homes within 12 months of entry into substitute care in fiscal year 2019. And, placement consists of a foster family, relative home care, care in a group home, or child care institution. State rate is 13.2% compared to 15.1%. So we actually have decreased our effectiveness in achieving permanency for indicated cases. Let's move on to the next slide. And this next set is all around our health domain. Prenatal care utilization. So again, you may recall premature births as well as maternal morbidity is definitely. So this is the REACH indicator for that. So the number and percent of births with adequate or above prenatal care utilization, because we do know that preventative measures can positively impact maternal health, infant health, and child development, and can also potentially can detect potential complications earlier in both the mother and fetus. And the state rate is 77.9% compared to 74.3% in 2016. So we've been able to increase our reach of moms with adequate or above prenatal care utilization, which is great. Moving on to the next slide, child nutrition. So this is the number and percent of income eligible children age 4 and under receiving WIC benefits. So that's the Women, Infant, and Children Program benefits in 2019. We know that proper nutrition, adequate nutrition is in the first 3 years of life is crucial to physical health and cognition. And the state rate is 59.99% compared to 61.4% in 2016. So we've actually had a decrease in moms and families accessing this important resource. And what's super interesting is that, you know, there's a pretty big cliff after the first year of life. And so we definitely need to do some work about it, ensuring that families know that they're eligible for this resource beyond the first year of the child's life. So let's go to the next slide, immunization. This is going to be interesting too, as we roll out vaccines regarding COVID in young children. So this is the number and percent of children age 19 to 35 months who completed the combined 7 vaccine series within 24 months of birth in 2019. Immunization, we know, can protect community health, and children too young to be vaccinated, those who are immunocompromised, and the state rate is 62.39% compared to 58.8 in 2016. So we made some headway there. And let's move on to the next slide. So lead testing. This is the number and percent of children age 6 and under tested for blood lead levels. So this is just those tested. And, you know, we know that there's no safe blood lead level for children, and prevention to exposure is super critical. Because even, you know, low levels can affect concentration, academic achievement. The state rate is 22.24% compared to 21.5% in 2016. So we have made some headway in testing, and of course we have a ways to go. Let's go on to the next slide, mental health services. So this is the number and percent of children aged 5 and under who are enrolled in and receive mental health services through All Kids in 2019. Now this right here is a universe of a universe of a, like a slice, right? This is not all children 0 to 5. This is children 0 to 5 who are receiving their health care benefits through All Kids, which is the state-funded Medicaid. And within that, those who are receiving mental health services. So, you know, we know that the research shows us that children can exhibit behavioral conditions, including anxiety, depression, post-traumatic stress at a super early age. And so obviously connecting them to resources is really important. The state has been doing some significant work around expanding infant early childhood mental health consultation. I know through the federal funds as well as through relief dollars, but also through the PDG grant. And so the state rate is 5.33% compared to 5.9% in 2018. So there's a slight decrease in terms of the number of children. But again, remember that this is a slice of a slice of a slice. It's not the universe here. And so I want to kind of point out, do we have animation on this one? I don't think we do. Yep, no, let's go to the next slide. This is the last of the health batch, the healthcare coverage. So number and percent of children age 5 and under enrolled in Medicaid, which is the state's children's health insurance program, as I mentioned, All Kids, and other public insurance in fiscal year 2019. So children with insurance, we know, are likely to have improved outcomes as adults in reducing risk of disease. State rate is 37.87%. And so this, again, this is definitely not the whole universe, but this is just those of publicly funded programs. So wanted to make sure that you all were aware of that. And then last section of these REACH indicators is the early care and education. And this is a lot of our this is obviously a lot of our work in our early childhood space, so kudos. Let's go to the first one, home visiting here. And we've got the percent of program eligible children age 5 and under enrolled in a home visiting program in fiscal year 19. Now we know that the programs vary, but broadly they provide, you know, parent and child services in the home, including parental education, referrals to improve child development. Ultimately, we are trying to prevent abuse and neglect and ensure that parents are supported in being able to support their child's development. State rate is 7.70% compared to 5.6%. So we've got an increase from 2016 in this particular area. Let's go to the next one, developmental screenings. And this is an interesting one because this particular indicator is the number of children age 5 and under who received developmental screenings and were reported through ChildFind in 2019. Again, this is a reporting data point. So it's not telling us all the developmental screenings that are taking place because we don't mandate that. We don't have, a mandate on centralizing all of this data around developmental screenings. We know that screenings assess children's hearing, vision, physical coordination, speech, cognitive development, social, emotional skills, all really critical in their development. And in our state, 109,149 children were reported having a developmental screening compared to 96,344 in fiscal year 2018. So let's move to the next slide. Early intervention. So this is, obviously when we do have concerns about our child's development, the referral is usually to early intervention if they are under the age of 3. So this is the number and percent of children age 2 and under receiving early intervention services in fiscal year 2019. And essentially, children with developmental delays, diagnosed disabilities, medical conditions, this is an intervention that, can ensure that they have their best chance at healthy development. The state rate is 5.12% compared to 4.5% in fiscal year 26. And it's super interesting, there's a cluster in that southeast section of our state, those counties, you see higher levels of reach in those counties. Yet you have quite a different experience in terms of risk factors, and it just kind of provokes some questions, like what's happening there where they're able to have greater reach. Now, granted, the reach, the highest it can be is 10.95%, but it's basically, it's one of those situations where you may have some neighboring county officials or local legislators that say, hey, what are we doing here that we could perhaps learn from? Because especially if you just look at the Clark County, right there at the border compared to Crawford County. Clark County has a higher risk rate, and then but very low reach, whereas Crawford has a lower risk rate but greater reach. So it would make me ask what's happening here and how can we improve the reach. So let's move on to the next slide here. So early childhood special education. So once a child transitions from early intervention and goes into, after the age of 3, this is the number and percent of children aged 3 to 5 receiving special education services, early childhood special education services, I should say. That includes specialized instruction, physical occupational therapy, cognitive therapy, speech, language, psychological services, and training and support for parents. The state rate is 8.31% compared to 7.86%. Now let's go to the next slide, high quality child care. So this right here is the number and percent of children ages 0 to 12 receiving child care subsidies who were in a gold circle of quality program in fiscal year 19. And, the gold is the highest standard in our quality rating improvement system, known as Accelerate. The state rate is 16.96% compared to 15.5% in fiscal year 17. I wanted to just say we included children 0 to 12 because there really wasn't a way to extract out the 0 to 5 population. So this was the closest that we can get. But I also want to point out, if you notice, The small dot in there indicates no data or 0%. And so there's, it's something important to kind of note here. We've got a lot of work to do in terms of access to quality. Okay, and then prevention initiative is the next slide. And it is the prevention initiative capacity, and capacity is a share of eligible children age 3 and under in fiscal year 19. And this particular program, comprehensive support that's needed for families that indicate that there's some concerns about their children and their development. But ultimately, this is kind of like infant toddler services and programs, and the state rate is 7.92% compared to 6.1% in fiscal years 2016. And our last early care and education slide is publicly funded preschool. And so what you'll see here, it is the capacity of publicly funded preschool and the gap between capacity and number of eligible children ages 3 and 4 in fiscal year 19. So available programs are state-funded Preschool for All expansion, federally funded Head Start. And in Illinois, the gap in available slots is 11,439 compared to 30,466 in fiscal year 2016. And so what I want to note is we just were looking at the cohorts of 3 and 4-year-olds. We did not have up to age 5 because we wanted to look at this at a cohort level. So just to kind of cycle through these next few slides here, just so you can kind of get a quick visual. I'm not going to go, too deep here, but, you'll see 2016 compared to 2019 in parental employment. This next slide looks at lead exposure, comparing 2016 to 2018. And this is meant, deeper dive, of course, when you have a chance to kind of go in and devour the report. But we want you to just kind of get the visual of looking at it from year to year. And then the 3rd grade proficiency in language arts. And the last piece here is, kind of looking at, let's go to these next set of slides, risk versus reach. So I mentioned them in looking at preterm birth in relationship to prenatal care. The next slide, looking at maternal morbidity in relationship to the reach of prenatal care. The next slide, violence exposure, looking at that in relationship to mental health services for young children. And then the child care costs in the next slide in relationship to child care subsidy. And then the child care costs in relationship to high quality child care. All of these data will also be on our website, and you'll be able to actually look at them even more kind of closer, where you can see what you can overlay the high quality childcare costs on, or I'm sorry, high quality childcare on childcare costs, so you can even get a more nuanced perspective. So the next few slides are just really to kind of wrap us up in terms of the report. And, we're not here to tell you how to interpret these data. We're here to provide and facilitate opportunities to have some discussions that could lead to action at a local and state level. And here's some questions to start the discussion. And then the next set of questions are specifically around how you can focus your conversation. So we're intentional about racial equity, understanding who's benefiting, who's burdened by the current policies and systems in place. And, I just want to leave you with some key messages overall from the report. The risk and reach report, can break assumptions about what we think we already know. Risk factors, strengths, they exist everywhere. It's not unique to one county, corner, region, and it's important to remember that risk is situated in the environment, not the individual child, family, or community. And the data is that starting point, right, for the deeper conversations about barriers, lack of access, and most importantly, how we can align resources, how we can more equitably allocate resources, but ultimately support the development of our young children. And, you know, local context is incredibly key in terms of how we make meaning of these data and ultimately what action we take. And for folks who are more interested in more precise data, the next slide kind of lets you know what ICAM can do in terms of drilling down to different units of analysis. So ultimately, I want to leave you all with, you know, you can download the report at the website. You can send us a note if you have any questions. And I am going to hand it over to my colleague, Ms. Liston, so he can kind of talk about the dollars and cents of this particular report.
Thank you very much, and good afternoon, everyone. If we can go to the next slide. So, as noted, so far we've looked at the risk factors for children under the age of 6 and the programs and services designed to address those risk factors. And now we look at the price tag associated with those programs and services. Next slide, please. A publication of the Fiscal Scan will go up online shortly. The listed line items encompass those programs and services chosen by the Risk and Reach Advisory Group. They represent a pretty good detailing of the services to young children and their parents, but keep in mind there are some benefits and services that are not included that can impact a household. For example, we talked about housing statistics, but not included in the Fiscal Scan is the dollar amount for federal housing vouchers. Also, because of limitations in obtaining the data, which I'll explain a little bit further in a moment, other line items are not included. Because this is partially designed as a tool for state policymakers to use in considering further investments for young children, it concentrates on state expenditures. However, there are expenditures made by the federal government directly to local programs and individuals. For example, the federal government directly funds Head Start and Early Head Start to the funder or local jurisdiction. And while the state helps issue the electronic benefit cards for the Supplemental Nutrition Assistance Program, the benefits actually come directly from the federal government. However, the advisory group felt these are important programs that need to be included in the full picture of investments, and thus they are listed in the Fiscal Scan. Not listed in this report are investments that local governments make in young children. That could be from a county, a city, a school district, or park district, and that would alter the fiscal picture and possibly give rise to further questions of equity. According to the Education Commission of the states, local governments account for 13% of pre-K funding in 2018, so that gives you just one example of where it would alter the landscape. The Fiscal Scan covers a timeline of actual expenditures in fiscal years 2018, 2019, and 2020, and then appropriations for fiscal year 2021. We felt it was important to use the actual expenditure numbers to show the actual investments. In addition, sometimes the appropriation line items are higher than what state officials actually intend to spend. This is because those line items may represent the authority to spend anticipated federal funds, and the federal government has not yet approved its budget due to differences in the state fiscal year and the federal fiscal year. Also, I want to note that the work concluded on the Fiscal Scan in the spring prior to the Illinois General Assembly passing the fiscal year 2022 budget, but also supplemental appropriations for fiscal year 2021. So there are a few line items that are not included here. Next slide, please. So as I mentioned, there's a difference between the state and federal fiscal years. The state fiscal year runs from July 1st of the prior year to June 30th of the named fiscal year. So the state's fiscal year 2022 runs from July 1st, 2021 to June 30th, 2022, while the federal fiscal year runs from October 1st of the prior year to September 30th of the named fiscal year. So federal fiscal year 2022 will run from October 1st, 2021 to September 2022. Granted, Congress regularly approves continuing resolutions, but again, with some uncertainty about the final federal numbers, For the federal fiscal year, the state frequently puts in a number for a federal line item that may be slightly higher than what is anticipated. So again, when you read the report and you see certain increases in the appropriation number, read them with caution. Next slide, please. Now, as for what is a state fund and what is designated within the state category and what is federal, we used the guide from the Governor's Office of Management and Budget and the designations that are made by the state. As a general rule, state general funds are those funds generated by the state individual and corporate income taxes, sales taxes, and perhaps other taxes and fees. They can be used by the state for, as the name implies, most regular operating expenses. What is classified as state other funds are generally accounts restricted to revenue generated for a specific purpose. For example, a professional licensing fee to handle the administration of programs regulating that profession. But it may also include federal funds that have been transferred into an account. And then there are funds designated by the state as just federal funds. Usually those are funds that can only be used for a specific purpose. Again, we went just for purposes of trying to get our arms around all of the funds and the project with the designations used by the governor's office. Throughout this report, the data is meant to reflect expenditures on children under the age of 6 and their parents. In many cases, agencies were able to parse out that data from overall program expenditures, but in a number of cases, they could not do so. So consequently, some data was left out of the report, and in some cases, because children age 6 and under represented the bulk of those individuals served by the program, the full line item was included. So, for example, the Child and Adult Care Food Program, which provides reimbursements for the provision of meals and snacks at child care institutions, family and group daycare homes, preschool programs, and before and after school programs. That program is administered by the State Board of Education, which could not provide the data broken out by age. But given how the program is crafted and the number of child care institutions involved, we included the number. On the other hand, the Family Care Assist Program, which provides medical care to parents enrolled in the state's All Kids Health Insurance Program, we could not obtain the data relative to just parents of children birth to 5. And given the range of ages of children in the All Kids program, we did not include that line item in the fiscal scan. But keep in mind, that program overall spent $1.2 billion in fiscal year 2019. So even if just a third of that was attributed to households with children under the age of 6, it would alter the overall spending picture depicted here. Next slide, please. There were other cases where we knew the number of children under the age of 6 participating in a program, but we didn't have the exact expenditure specifically tied to them. For example, we know the number of children birth age to 5 enrolled in the SNAP program. The benefits come from the federal government, thus we used a formula incorporating total participation to approximate SNAP expenditures for children under the age of 6. But as you look at the expenditure and appropriation numbers in this report, keep in mind it's not just the dollar amount, but also how the state distributes those funds throughout the state. In some cases, organizations need to submit a proposal for the funds. In some cases, the funds flow through local governments, and then there are cases where individuals need to sign up for the program. That can well impact the reach data that you see in the risk and reach report. And given the risk data should also bring into consideration the question on the manner in which funds are distributed to meet the needs of children across the state. Next slide, please. So I mentioned that the time frame is an arc from fiscal year 2018 to fiscal year 2021. But the baseline for much of the data in the fiscal scan is fiscal year 2019, and that was done for several reasons. First and foremost, it matches the fiscal year 2019 data in other parts of the risk and reach report. Second, as you veer into fiscal year 2020, you'll begin to see line items that are influenced by relief for the pandemic. which hit full force in the first quarter of calendar year 2020. The federal government responded to the pandemic with a number of relief packages, the first of which had passed in the spring of 2020. The Families First Coronavirus Response Act, signed into law in March of 2020, allowed states to provide emergency supplemental benefits under the SNAP program. Consequently, all Illinois residents enrolled in SNAP began receiving maximum benefits in April of that year. The same federal law also temporarily increased the matching share of the state Medicaid costs, called the Federal Medical Assistance Matching Percentage, or FMAP, to help states pay for increased health care costs associated with COVID-19. In June of 2020, Illinois approved an additional $500 stipend to individuals in the TANF program. So again, as people use this report, the question will be, fiscal year 2019 will generally represent the trend line that had been occurring up to the pandemic. Then we have the alterations because of the pandemic, but impacts of the pandemic will remain for some time. So what is the best baseline to use financially? Next slide, please. So when we put it all together, what do we have? And we come up for fiscal year 2019 with a price tag of around $4.39 billion. Now, of that amount, $3.638 billion is state appropriated. $747 million is the federal government spending for SNAP, Head Start, and Early Head Start. Of the amount in this report that goes towards children under the age of 6 and their parents that the state is spending, when you compare it to the general state operating budget, which is larger than just the general funds budget, that comes out to the state spending approximately 5.5% of that amount on young children and their families. Compared to the last fiscal scan, and when we looked at fiscal year 18, that share was 4.9%. But in that last scan, we did not include the funding level for the state EITC, and there were other changes that have occurred during the course of the year span, such as increases in early childhood education and also care. Next slide, please. Again, this is the breakout on the state appropriated amount, and it comes out to 5.5% of the state operating budget. The state general funds budget for that year was $4.3 billion. If you were to compare it just against that, then the percentage is closer to 9%. Next slide, please. So how does everything look when we break it out? Well, as you can see here, more or close to half of the expenditures that were designated by the group are for healthcare. And again, that is without including the amount from the Family Care Assist program that would have gone to assist parents of children under the age of 6 who are in the All Kids program. The family stability section represents 16%, but here we're only including the state EITC. So I'll just point out that if we were, for example, to include the number of Illinois families and households with children under the age of 6 taking the federal EITC, that would have been bigger as well. Next slide, please. So what are some of the trend lines that we see as we look across the report here? Funding has gone up under the Early Childhood Block Grant. Funding has also gone up for the Child Care Assistance Program. That is largely influenced by an influx of federal funds that came about with Child Care Development Block Grant increases under 2019's congressional approval, and also the relief packages that have been seen to deal with the coronavirus. All Kids enrollment is down, and caseloads for children under the age of 6 have been going up. And then also listed here are some of those items that I mentioned that would impact fiscal year 2020 at the end and beyond. Next slide, please. Okay, so let's delve into the individual sections here. For early care and education, you can see that the expenditures on preschool and the prevention initiative represent just under a third of the cost. If you add in the expenditures for Head Start, that comes out to more than 50% of this particular category. Childcare makes up just under a third. Home visiting is a small part of the pie here, and as many of you know, Governor Pritzker announced in early 2020, pre-pandemic, that he wanted to expand the home visiting program statewide. Next slide, please. And we can take a little further look here, and you can see the increases in the early childhood education realm. Now, I will add that this is money for the Illinois Early Childhood Block Grant Program, but also what occurred in fiscal year 19 when the request for proposals went out is there were far more proposals than funding that was available, and an additional $6.4 million was shifted over for the program from the Department of Human Services. The Department of Human Services was able to provide us with the actual dollar amount when all of the funds for the Child Care Assistance Program are taken into account and what that meant over the course of 3 years. And you can see there the increases. And if we go to the next slide, please. You can see here from the line item that is Child Care Services Federal, the increases that have occurred in federal funding that has helped with the increase in expenditures. Now, I mentioned that this was pre-pandemic and most of the information here did not include what occurred at the end of May with supplemental appropriations, but this is significant, so I will just note it here. There was an additional $350 million appropriated for grants and administrative expenses associated with child care services. And then on top of that, there was an additional $1.3 billion, the bulk of which was for stabilization funds under the American Rescue Plan for child care for the child care industry, the remainder of it being increases in funding under the Child Care Development Block Grant Program. Now that money is appropriated not only for fiscal year 21, but also 22. And to give you an indication, along with a stabilization restoration program, how the money is spent, we'll go to the next slide here. And you can see what DHS has indicated in that is going to be using part of this money to make sure that the amount of payments by families is $1 per month for families with incomes at or below 100% of the federal poverty level. That family payments will be capped at 7% of family income. That the exit for the CCAP program will go to 250% of the federal poverty level instead of the current cap of 225, and there is a rate increase of 3.5% for all CCAP providers. Next slide, please. The health section. So the health section predominantly is for funding under the All Kids program. And if we go to the next slide, you can see how that is broken out. So we mentioned before about mental health services, but what you'll see here is that as far as the All Kids program goes and expenditures for children under the age of 6, mental health represents a relatively small amount along with dental. The other thing that you can see here is that the All Kids enrollment is going down, and that really is the result of perhaps two factors. One is the economy during this time period was improving, but I'll also note that in late 2017, the state switched to a new computer system that accidentally impacted in a negative fashion eligibility for people who were on the Illinois Medicaid program, and that could have been an influence here as well. Next slide, please. But there is also a decline in a program, WIC, and this decline in participation actually follows national trends. As you know, the Women, Infants, and Children program provides food, nutrition education, breastfeeding support, and referrals to healthcare and social service agencies for low-income pregnant women, and then parents with infants and children under the age of 5. It's an extremely important program when it comes to the health of young mothers and children, yet not only is there the decline seen here, but from February of last year to February of this year, during the height of the pandemic, when far more individuals would have been eligible for the program, nationally, WIC participation increased by only 2%. We noted before the participation level at just under 60%. And so part of the question here is not how the state is distributing funds, but rather how are we making women aware of their eligibility for the program and signing them up? Next slide, please. Here you can see the fiscal scan for the family stability section. Again, we did some estimates here to come up with the SNAP level, but the economic supports represent a large part here. And I will get into how it could potentially have been even larger had we included some other factors. Next slide, please. So one of the items that we have included this time around that we did not include last time is the state earned income tax credit. And of the households that filed to take the state EITC, about 31% of them are households where there is a child under the age of 6 living. I mention this because the state EITC and the federal EITC are very important components in terms of how households deal with their basic needs. How do they use the funds? Well, one study that was done several years ago found that roughly half of the refunds were used for current consumption, such as groceries, childcare expenses, other children's expenses such as clothing and furniture. The other half was paying off past due bills and debt. So it's an important component for asset building. Again, keep in mind what we have not included here is the state EITC. And then on top of that, as is marked today by the first monthly payment under the new provisions of the federal child tax credit is the child tax credit. If we go to that slide, next slide for a moment. You can see here that of the some 6 million returns that were filed in 2018, this is before the increases in the federal child tax credit, there were 1.5 million individuals who took the child and other dependent care tax credit, that is of Illinois filers. The American Rescue Plan has increased the value of the child tax credit from $2,000 to $3,600 for children under the age of 6 and $3,000 for other children under the age of 18. It's increased the scope of who can apply for it because it has changed the age range, and it is providing an advance payment now so that monthly over the next 6 months, households can get 1/2 of the credit that they may be due under the child tax credit. Again, this is an important economic support. It is estimated that the increases in the child tax credit on the federal level alone will cut child poverty in this country by 40%. And when you combine it with the additional funding for SNAP, housing, and unemployment benefits, it's estimated that we will have cut child poverty in this country by 1/2, but that is only for 1 year. And it is something to consider to make permanent. I will also add that there are 25 states in the District of Columbia that have either a state child tax credit or a state child care tax credit. Next slide, please. Participation in SNAP, you can see that obviously as the pandemic started to hit us full force in 2020, participation went up significantly. Next slide, please. And then we come to the Department of Children and Family Services. So there are 2 trends that are going on here. Many of you are aware of some of the, we'll say, needs that were noted by Chapin Hall and other organizations regarding some of the operations at DCFS, and the agency and the General Assembly made a commitment to correcting those, and additional funding has been provided for more caseworkers and other operational needs. What the department here did, and we appreciate it, is they tried to pull from all of its electronic records the spending on children under the age of 6. We are also including in the full fiscal scan, though, the money that is spent on each of these areas for all ages so that you can see how it fits in relative to the expenditures that are made for children under the care of DCFS in the state of Illinois. Excuse me. Next slide, please. Here, however, is a troubling trend. the agency was able to pull, the agency was able to pull the records of children under the age of 6 under the care of DCFS. You can see here from fiscal year 2019 to fiscal year 2021, there is a 29% increase. Part of that is due to the opioid crisis, and we'll see what the pandemic brings on and whether that increases the caseloads even further. But that also accounts for some of the trending that you're seeing under the expenditures. And I will just note, as many of you know, that while 8,600 is a small percentage of the 900 plus thousand children under the age of 6 in the state of Illinois. These are obviously children who have special and high needs because of the circumstances that they face. Next slide, please. How to use this report, and some of this has been referenced already, but I will just note something about the Illinois Commission on Equitable Early Childhood Education and Care Funding that the governor appointed at the end of 2019, and that worked through most of last year. By its own admission, the group was really looking at just the early childhood care and education realm, but as many of you know, there is more to it in terms of the impacts on a young child. There are the healthcare needs, the mental health needs, issues related to economic support and child welfare. And so we ask you to take a look at the expenditures along with all of the risk and reach data in this report in the total realm of factors that are impacting a young child. Next slide, please. And then, of course, there are the impacts of COVID-19 and what does it mean going forward. We have lost learning opportunities. We have direct healthcare impacts on individuals and on the healthcare system, and many of the public healthcare entities throughout the state were very stressed. We have the impact of lost parents and grandparents. More than 23,000 deaths due to COVID, probably another 2,400 deaths related to COVID. So what should be the baseline going forward? Is it fiscal year 2019 and the trending we were going along and factoring in that, well, there's a certain amount of money available for a limited period of time from the federal government, so we use 2019, or do we then say we have to recognize the needs are different given COVID-19 and we have to use that baseline as our direction going forward? I believe that is the last slide, and I will turn it back over to the senator and however you wish to proceed on Q&A.
All right. Sorry there. Hi, everyone. Just at this point, I know we're a few minutes over and we want to respect people's time and appreciate you sticking on for it. And so feel free to send us a note if you have questions. I know that the website is in the chat for you to access. Be on the lookout for the updated data in the interactive website, but you can download the static report for now. Really appreciate your attention and look forward to your support through the dissemination strategy and how we actually move this to action. So have a great rest of your afternoon and take good care. And I'd like to thank our partners once again, and also thank the funders as well as the advisory council and the Dynamite Erikson team. Thanks everyone, take care.